Alrighty, and we are live with our April Parent Conference with Dawn Health. This month we've got Jim and Panos here talking from a counselor's perspective, from parents' perspective, and the topic today is adolescent depression and kind of how to tackle it, not view it as a sickness, but view it as something that we can all come together. Panos, Jim, if y'all want to give some brief introductions, we can move into the conversation.
Sure. My name is Jim Simney. I am the Vice President of Care System Excellence and excited to be here with you. And really briefly, I've been in the field for about 32 years and completely believe in our model here at Dawn Health, which is proactively engaging families and their children to take charge of their health and mental health to build resilience and adaptability. So thanks for being here.
Awesome. Thank you,
And
Jim.
I'm
Go ahead,
Panos
Tanner.
Zepsa. I'm Panos Zepsa, the founder and CEO of Dawn Health. And just like Jim, I'm coming from the perspective of a parent, but also, taking, I would say, the clock back when I was a teenager, and I was struggling as well with, academics, with friendships, with bullying, and many other things that a lot of the kids today struggling with. And parents have to be a part of the solution and a part of the problem.
Absolutely. And so I know we're all from Dawn Health, and we all believe in this growth and preventative health for adolescents and children. So how do we at Dawn Health kind of work with children that are suffering from depression and trying to work their way through it?
Sure. Well, I think I can, add some value to that question. As a parent of three, I have a 20-year-old son, an 18-year-old son, and a 17-year-old daughter, as well as what Panos referenced in his adolescent teen years. I had similar struggles. So I think, what we do here at Dawn Health is really come together not to look for pathology. We come together to build composite strength between the members of the family and lean into our expertise. And, depression is a diagnosis that is 100% valid, but there's also some descriptors within that diagnosis that can also illuminate what is normal adjustment for a teen, whether it be socially, emotionally, whether it be academically, behaviorally. There's a lot of overlap between the clinical diagnosis and moodiness or things that are expected that teens, do experience. So, we really advocate to look for, how do we look at both sides of that and not just jump to pathology, but how can we use a strength-based perspective to rule out which one is it and then build that strength within the family unit.
Awesome.
And to add to that, to what Jim said, one thing that we need to understand too as parents is that when we talk about mental health nowadays, right, and it has been happening for several, I would say, decades now, mental health comes with a stigma. So a good way for us parents to get away from that mentality is not perceive mental health as an illness. Because then what we tend to do is trying to find ways to cure it. We trying to, sometimes we fall victims of, that a pill will do the job. In reality is we need to do a better job understanding it, not just as parents, but also the clinicians themselves. The principle of understanding is not just around depression only, but any other mental health symptom, and allows us, allows healthcare systems to build solutions tailored to each individual. And in this case, that we are focusing on adolescents, really not just the individual child, but also the environment within they interact and live in, right? Their household. And as we've said before, parents are an inseparable part of this system. And that's why we at Dawn Health, we believe that the success of the tripod, child, parent, Dawn Health.
Absolutely. I know, Panos, you have younger children, and Jim, you've got older children, some in or correct me if I'm wrong, but I know you have a son in college and then 2 in high school.
Correct.
And then Panos, you've got 2 under 5 with 1 on the way, right? So I can see how y'all have different, you're in different stages of parenthood. And Jim has been able to be with his kids for these 18, however many years. And Panos is kind of in these beginning stages and can really lean into this preventative portion of really what Dawn Health leans into. So how do your phases of parenthood that you're currently in, how does that impact the work and how you view adolescent depression?
Well, I think I have a great front row seat from the vantage point of my own children, and when I reflect back on my journey in my mental health and wellness, and it gives me great joy to be able to converse with my children, to have those honest and open discussions, which I think are critical in laying that foundation for just openness and vulnerability. And like Panos said earlier, we're not here to pathologize something. We want to look at mental health and use that word health. That's a strength-based descriptor, and we want to build off of that. And that's part of the whole pie chart of wellness. Mental health for many, many decades, like Panos alluded to, it's always been taken out of that pie chart and put over here and stigmatized. We want to bring it back in and look at that as being something that's valid, wholesome, and part of the equation. So, when I speak to my own kids or when I work with different families, we're always looking at the whole pie chart of, what is your activity level? What's your wellness plan? What's your nutrition? We're looking at metabolic health. We're looking at strength-based pieces, as well as, moodiness or depression, and not assuming that it's one or the other, but laying the foundation to have the open discussions, which is critical.
Yeah,
Absolutely.
indeed. And of course, what I would say is that we are treating, what we are approaching, and we're seeing, and we say depression in this case much differently nowadays than we did 10 and 20 years ago, right? When I would say I was a teenager. So therefore, we have a better understanding today, but I don't believe that we have grasped the fact that parenting is a key part of the whole system, not just the therapy itself towards the individual, that it can include, of course, gut health and that leads to brain health, but also the parenting piece is important, because as parents, the truth of the matter is that we hold we're tied down with an anchor of trauma and other things that we drag along all these years. And we tend to carry that on to our kids. And of course, that adds to the problem. So one thing that I would say as a parent, I want to have is support for me to be a better parent, right? I need to be an eternal learner through Dawn Health, and work with the care team to be able to become a better parent. Now, on the other end, we have to understand that every child is different and unique on its own way, because not every child comes from the same background or the same environment. And that's what makes it also a very unique approach in our care delivery model, that we tailor our care to understand that parent-child relationship and build upon that, right? Not just assume that, here's some tools and then you go with it, and everything will be fine after 2, 3, 4, 5 sessions. It's not a matter of sessions. We put the family at the center of our care, and then we focus on the progression of care. Are we progressing, right? I'm not a baseball fan per se, but I would say I'm a fan of the following saying: we don't try to hit home runs here. We try to get on base every time, and that's what we have built, a system where it allows our providers, our clinical care team, to get on base every time with every child and parent. At the same time, we are one of the few systems out there that allows the parent to also seek help through us, not just in the matter of checking in or just coaching and guidance. We're talking about therapy themselves, because me as a parent, I would need that support from Dawn Health, from the system, right? If I want to become a better parent, because again, we do have some anchors that we're dragging through the bottom of the sea, I would say, right? And we gotta let go in order for us to become better parents and set up our kids to be successful.
Mm-hmm.
Absolutely. From your perspective, Jim, and with your professional experience and educational past, how is Dawn Health, how is our system, which we equip parents alongside children, how is that going to, or in your opinion, how is that going to impact the overall well-being of these kids? So when they have sessions, they're going back home to parents that are equally as educated as they are and on that same pathway. They're not just in a room by themselves. They're there with their parents, and it's a really whole family. So how do you see that impacting the children's well-being as they move forward in relation to depression and anxiety and everything?
Yeah, great question, Gabby. I think, to build off of Panos's analogy, that's the home run right there. There's not, what we do that differentiates ourselves from any other platform or system is really build at the core of involving those parents and guardians. When I started in this field, the traditional pathway was pathologize the child, bring them to an office, put them in the office with someone that neither one of the child or the parent knows well, and then the parent stays out in the waiting room and waits until the kid comes out. That's the farthest thing from collaboration. That's the farthest thing from communication. What we've built here at Dawn Health really emphasizes the fact that we want and we need parent guardian involvement. They are an equal important part of that process. And then I think, the thing that really maybe is the hugest impact, which maybe can't always be captured or realized in the moment, but we're also setting the tone for generations to come. And I think when a 14 or a 16-year-old adolescent teen sees the collaboration and sees the glue that we're offering to bring us all together to promote progression of care and wellness down the road, they're going to lean into that model as well in the decisions that they make and the choices that they make, or if they become parents themselves. So I think, maybe the uncalculable greatest gift is maybe a couple decades down the road, if some of these teens and adolescents, start their own families. They now have a model of excellence. They have a model of communication, and that's going to help break a cycle, and it's going to empower them to be healthier as a result.
Yeah, that's a great point. I mean, I would say, looking, forward looking, right? That our kids eventually will become parents, right? In the future, and whatever they learn and whatever they experience now in the early years, I mean, it will be their anchor, right? To drag along at the sea bottom, right? Just like we do. I would say one key element is that, and I want to touch more onto this, is the element of understanding. Right. That's why, as I keep saying, and I will repeat that over and over again, is mental health is not a disease that we can try to cure. And the principle of understanding is important because the conditions and the situations and the socioeconomic facts, change year over year, much faster nowadays than it was 10, 20, even 100 years ago. So if we understand that, then it's very simple. It becomes very simple for us to realize that continuous understanding of the environment that affects us and as individuals and as parents, but also our kids, is going to help us become better caddies for our kids. Because we cannot just have the same expectations to our kids as our parents have for us, or we have for ourselves. That's for sure. Different. Nowadays, let's look at the last 10 years. If you're a teenager, you have gone through the Great Recession. You have gone through, a socioeconomic turmoil, and I would say the last 4 years, between the pandemic and the global wars that have been happening and continue to erupt. It's very difficult. If it's difficult for us as parents and as individuals and as adults, imagine what it is for kids that they see the news, they see, especially now in the social media world, right? And of course, those who get directly impacted through bullying, through many things. We see that every day in the news. So again, Dawn Health is here to make us parents be, I would say, better collaborators for with our children. But to do that, we have to be better in understanding, we're not there yet. I mean, I can say that from personal experience as a parent, right? I mean, sometimes my daughter will say, you know, I'm upset. And she's barely 3 years old. And I'm like, where did you even learn to say you're upset, right? And I think I said this in the previous conference that, you know, what can you be upset about? I mean, come on. That's wrong, right? I mean, I need to understand, right? I need to ask the why. So that's why I love what we have built with Dawn Health, because we cannot be asking the why more and more often as parents, just like we used to do when we were little. And our parents would say, no, you cannot do that. And we say, why? And it would become, you know, so annoying to them with how many times we ask why. So I think it's time for us to resurface the kid that lives inside of us, and that will help us become better parents, no doubt about it.
Yeah, great points. Thanks, Panos.
And I think you've both touched on this, and with the care team. I know, Jim, you spoke on it with a kid goes into a session with an adult that they're not super familiar with. And then maybe they are able to have a couple of sessions and then that relationship ends. How is that different at Dawn Health when our care teams truly build these relationships with these families to have that longevity? How do you, one, I guess it's a two-part question. How is that different? And then two, how do you think that's going to, similar to the last question, how do you think that's going to impact the long-term success, like you said, like that 10, 15, 20 years down the road, after they have all of these experiences with Dawn Health and with the care team that's consistently seeing them and paying attention to them?
Yeah, great questions. I think, you know, the number one task for any, you know, credible clinician is to earn trust and build rapport with their clients. And that shouldn't be given, that needs to be earned. And I think we really pride ourselves on offering empathy and perspective and collaboration to safely bring in our teens and adolescents, as well as, you know, the parent guardians. You know, so that task is on us to really, you know, make sure that happens. And I think when we accomplish that and we do that consistently, I think that really creates a safe space now for wonderment, a growth potential, and then maybe repair. And once again, we're not just going right to repair and assuming damage or dysfunction. We have to go through a continuum of earning that trust, building that rapport, and getting to know our families, so that, you know, like Panos alluded to a few minutes back, we need to look at the function of the environment. We need to look at the function of the health history, all of these factors, you know, academics, social. We're looking a lot at metabolic health. You know, what is the client's consistency with nutrition, looking at exercise, what does their scheduling look like, what does their sleep look like? I mean, all of these factors are critical, and those, I won't say are easy wins, but I much rather as a clinician start over here in that least restrictive zone rather than bypassing all of that stuff that I have a responsibility to assess. I have a responsibility to help teens, adolescents, and parents and guardians adjust. Because if we do that, we know we will get great results. We know that symptoms will be reduced, functioning will increase. And we're not going to go right from the starting point and bypass all of that critical strength-based information just to take the easy route to go and slap a diagnosis and pathologize a kid. It's our job to start over here and build up, because if we can do that consistently, we're teaching, we're learning, and we're growing. And when we do that at Dawn Health, everyone wins. And once again, to your point, Gabby, that's life-giving forever, not just situational because we happen to meet them.
So Jim, I have a good question for you then. As a parent, right? I know that it's, you know, I see for example nowadays, right? Everybody's looking for the quick fix, right? And you can see, we read the news about, you know, the diet pills and the diet, you know, trying to, you know, way to cheat the system, right? You not to put that hard work. So with that said, what is your perspective as a clinician in regards to is medication the only way to fight depression? And as a second, I would say, question coming out of it is, what will be some adverse, we'll say, unintended consequences or even intended consequences for medication to specifically young kids? Because we see that suicide rates continue to increase across all different age groups. But if my perspective is, if I put my parent hat on, if the pills were doing their job, why do we have continue to have increased suicide rates?
I think it's a honorable question, and I go back to my continuum of care, my progression of care. For some cases and from some situation, medication is 100% accurate. And I will refer people, for that consultation if need be. But I think, as a clinician, it's my duty to skill build. It's my duty to build perspective and strength, to untangle things that are impeding the function or the progress or the development of that client, or maybe that whole family system. And, if we bypass all of that learning growth potential to utilize a pill, that's not going to fix everything that we skipped over. That might be situational improvement, but we still have not gotten to the root of what the dysfunction is. Now, we may still do all that great work with a family. We may see the care progression, measurement-based care lead us to a place of celebration. But as we move from least to most restrictive, medication might be a discussion down the road that is still needed to be had, but it's not one that I would recommend going to immediately. And the second point of your question, Panos, what's the long-term effects? That's hard to really quantify, because if I'm working with a family and I have a healthy, robust, trusting clinical relationship with that family unit, odds are I'm probably not going to have to wonder about whether or not that medication is going to have a long-term adverse effect on the child, because great things are already happening down here in the least restrictive zone of care, which is where the greatest work is had and done. So it's an honorable question. I guess I don't want to have to worry about that because I didn't do my job down here. And that's where I go to as a credible clinician is, I have to exhaust all these things to be able to have that conversation. And if I get to that point, I can prove to myself, the family, the client, the care team that, we need to have that, because everything else, all other boxes have been checked.
So Jim, kind of coming out of that insight of yours, if you were able to turn the clock back, right, and talk to yourself as a parent. As a parent, I would say of all your kids being in the adolescent period of their life, based on what you know today, especially on the topic of depression, where would you have guided your children towards that maybe you haven't had the opportunity? And then also, where have you looked at yourself in the mirror and say, you know what, you need to watch out for this, or you need to do a better job for this as a parent?
Yeah, that's a great question. I was just talking to a client earlier today, and it was a 16-year-old male who is aspiring to go to college and become a physician. And I was meeting with him and his mother. And, I would answer that question the same way. As I told them, and we worked together, we really focused on 4 prongs. And I wish I would have had that knowledge back then. I came from a great family, great parents, but there just wasn't a deep dive into the research of what the value was of the 4 prongs. Number 1 prong is, develop a consistent schedule. When I'm meeting with, teens and adolescents, and I'm talking to their parents and guardians, every day is just a large majority of the time, every day is a random shot in the dark. Like, there's not a lot of consistency. And I really, really try to work with my clients to build capacity that if we know that Sunday night through Friday morning, school nights, we know how that's going to play out. Let's embed things that are going to be life-giving, consistent, and strength-based, so we don't have to reinvent the wheel on Monday, Tuesday. Let's just do Monday through Friday the same way. We then talk about exercise. We talk about physical activity. We've seen with the surge in social media, the use of technology, we all have to hold on to technology for our own, progression, whether it be professionally or preferred social avenues, whatever it might be. But I also see that really impeding, the function of our teens and adolescents. And as a result, they're more glued to the device than they are to get out and get into the sunshine or get to the health club or go for a walk with their family or exercise or be part of extracurricular activities. And don't get me wrong, we all need a little bit of isolation, but we really want to build that capacity that they take charge for their wellness. And that includes developing the consistent schedule, the exercise, and then nutrition, looking at the state of our country and what the implications are of poor nutrition. That also is going to be a depletion for generations to come if we don't teach this current generation how to do differently. And that's on our clock as clinicians. We need to educate. And lastly, probably maybe even the biggest one is sleep hygiene. I would say if I had to throw a dart at the board, to be honest with you, I practice in a large setting with, I should say I focus on adolescents and teens, and I would say probably 7 out of 10 of them probably do not go to bed probably until after 11, maybe midnight. And they still have to get up at 6. And we know that the brain research tells us they need a good 7, 8, 9, 10 hours of sleep just to be back to neutral for the next day in full capacity. So schedule, exercise, sleep, nutrition. I needed to hear that discussion when I was 15, 16, 17. And I didn't hear that. And it wasn't because of, poor upbringing. It wasn't researched. It wasn't reinforced. And now we have the knowledge. And at Dawn Health, we've also incorporated metabolic health. We have nationally certified health and wellness coaches that can work directly with our families to empower not only the teen and the adolescent, because keep in mind, when we put the spotlight on that teen and adolescent, there's a high risk that they are going to feel scapegoated. They're going to feel shame. They're going to be the identified deficit. And we need to come at it from a family perspective to say, this is well for everyone. So why don't we be well together rather than put the spotlight on that 16-year-old or that 9-year-old? We need to build capacity, and the whole family has to embrace those 4 principles of how do we schedule and function? How do we do wellness as far as, physical activity? What is sleep schedule? What is nutrition? And when that 16-year-old sees parent, guardian, siblings buying into that, they now feel less of the scapegoat and they feel more empowered to take a healthy risk and give it a try rather than immediately resisting it because they're scared and they feel vulnerable. So thanks for asking.
So pretty much what I hear you say, Jim, is that we as parents, we have to know the way. We have to be able to, to show the way to our kids, and then also go the way with our kids. And what I mean by that is, pretty much if we expect them to present specific habits, that they're good habits, right? Based on what I'm hearing you saying, is we have to do the same thing. But most importantly, to do that, we ourselves, we have to be able to know the values of these things, because it's interesting when you talk about, going outside. And there was a recent research report that was, published in the National Institute of Health, and back in 2022, that was saying that, there's a correlation between vitamin D, right, and symptoms of depression and anxiety. And as I was reading that report, I wanted to reflect back when my teenage years, which I was never in the room. We were outside of the school all day long playing soccer, basketball, and we were running around. I mean, we didn't have computers and tablets or cell phones back then in the late 90s. And we used to be out all the time, weekends, during the weekdays. And nowadays, right, I see how as adults, we have encapsulated ourselves in an office, in a room, in front of the computer. And by God, I mean, like, the symptoms are more visible now than, if I look back when in my teenage years, there was no even a speckle of depression around me. I mean, and, there were hard times too, but never, ever a speckle of depression. And nowadays, I look at kids. I speak with kids. I speak with parents. I reflect on my own personal life. My goodness. I mean, depression is like circling around every day. But when I find myself not going outside, it becomes even more depressing. So definitely, I really love that idea. But one thing I wanna ask you, as we're coming close to this, is where do we need to look at as parents? What do we need to look at? Where do we need to look at? Because depression is a killer, right? For the relationships, it's a killer for beautiful lives of young kids and also adults. So where we should be looking at? What is it that we're missing as parents?
Sure. Well, I think, from a clinical standpoint, when we look at depression versus moodiness, we have somewhat the expected, the average teen is going to have episodes of moodiness. The maybe the unexpected is a clinical diagnosis of depression. So, from a parental standpoint, when we work with our families, we're really teaching around and trying to data mine, what is the duration, what is the intensity of the parental concern or the self-reported concern by that adolescent teen, or what are we observing during that, maybe that initial intake, because that's going to be a window into the complexities or the simplicity of what's going on. When we look at moodiness, a 16-year-old or a 9-year-old can be moody if there's parental dysfunction, or like you said a short while ago, if we as parents have our own struggles that we haven't unbinded or untethered, we're going to be projecting that into the family system, and that could cause our own children to present as being moody or be miscalculated as being depressed. So we look at the duration, the intensity of the symptoms. That's going to help us guide, what is our path that we're going to, try to, unearth with this family. We're looking at changes, every teen that is moody, I should say most teens that are moody have episodes of isolation. When they're mad at the world or they're upset, they want to be alone. That doesn't mean instantly that they're depressed. So we have to really come at this from a calculated standpoint, and we have to manage risk, because that's real as well. You talked about suicide rates. We talked about, the adolescent mind. It's a vulnerable, state to be, even on the best days. But we have to look at risk factors too. And we have to come into this to include parents and guardians, because that composite strength of what we do, and our nationally certified health and wellness coaches, from a metabolic standpoint, we're all stronger together. So, that's how I work with my clients. That's how we work with our clients here at Dawn Health, is we really want to invest, empower, and look at it from, the duration, intensity, and risk level. And then if it is a case of expected moodiness, let's call that out. Let's celebrate that. Let's normalize that. We can't take the moodiness out of a teen. My parents couldn't do that for me, with me, I should say. That was impossible. And that doesn't mean that they failed. That just means that they had an understanding that Jim's having a moment. He's 16, he's 17. Oh yeah, we used to be like that. But if there was rapid decline and changes with duration, intensity, risk, that would have prompted them to come in quickly to look at that from a different lens and perspective. So we want to honor both, that every kid that we work with, every family that we work with, they love each other. They want to be their version of better tomorrow. It's not for us to judge, but we want to lift them up and celebrate them, and use strength-based clinical practice to help them achieve that.
So Jim, out of curiosity, what would be one thing that we're really doing well as parents nowadays, based on your experience, and what will be one thing we should do better? If you just have to summarize, what is one thing that we do good as parents? I mean, and when I say we, right, you have come across, I'm pretty sure, some best practices, some of the great examples, and then also what we should be doing better at.
Sure. I think the last 3-4 years, maybe 5 years, has really forced all of us to look in the mirror a little bit more intentionally. And coming out of COVID, after that time frame with isolation and protocols and whatnot, it really forced us to have to and our function and our purpose. And when we had that vulnerable space, we had to make a change, and we had to honor that. So I feel like families are honoring mental health a lot more. There's a yearning for support. There's an acceptance for support. And it's not only because of what you hear on the 10 o'clock news. It's not only because of data. It's really in large part because parents and guardians love their kids. And now that they know more, and maybe they had to unravel and rebuild part of themselves, they now want that better version, or they want to examine, is it a better version for their own child? So, I think that's, awareness, acceptance, and outreach. I see that as being a huge strength-based, perspective these days. As far as what could be better, I come from a background of emergency medicine, outpatient, inpatient, national, international adoption, school, K-12, teaching at universities. System mental health has never been really a strength. And I don't say that to shame professionals in different settings, but the care progression, the handoff, the seamlessness has been void or lacking. What we do at Dawn Health is we've really built a system that is positively insulated to make sure that there's no fumbles. We work together, we collaborate, we communicate. As a whole, we're really proud of that. And I think people really feel safe, they feel respected, they feel honored. And I'm grateful that we're not fumbling, because I've been part of those systems and there's a breakdown. So what could be better? I think mental health service delivery as a whole, there's a lot of room for improvement, but I'm grateful that we are building something that is, strength-based and consistent for families so that they can feel respected. They are invested in the process, and we're using measurement-based care to give them real-time data, honoring their self-reports of, their child adolescent, listening to the kid, as well as our clinical observations. And you put that all together, that's one heck of a recipe for improvement, if you ask me.
Absolutely. I know we are coming up on kind of that 40-minute mark. We're a little over 37 minutes right now. And so as we wrap up this conversation all about adolescent depression and how the whole family has a role in it, and the parents are more keyed in than they have been in the past generations, what do both of you gentlemen want to leave our audience with, kind of thinking about, and something that they can take into their day-to-day lives after we end this session?
I guess I would leave our audience with the spark or the charge to be proactive. If we're able to work with a primary care physician once a year, if we're able to work with a dentist, once or twice a year, if we're able to go see a specialist, if we're able to be proactive on all these other pieces, I wonder why we're not being proactive with mental health. Because we all go to take our kids to pediatricians or primary doctors to do, annual exams or maybe blood work or sports physicals, all those things. That's really easy. That's normal. Well, why not make mental health that same slice of the pie chart, to be able to work to build things up proactively rather than to wait until things are depleted and dysfunctional. If we can get to that neutral spot at Dawn Health, the sky's the limit and what we can do for families and how we can help them. So I would leave our audience with the idea of being proactive. We're here. We're flexible. You can pick your time. You can pick your clinician. We're here to be flexible to serve your needs based upon your preferences. And we take it seriously to really build that relationship and that rapport and help you not only meet but exceed those goals. So look us up and be proactive. Don't wait for the big symptom or the fallout. If right now things are well, maybe right now is the best time to work with us.
Absolutely. Panos?
Yeah, that's great. What I would say is, when I would say, bring back one sentence that Jim mentioned is about risk management. I would say, as parents, our job is to be good risk managers for us as individuals, but also our kids. And I don't believe nowadays. I mean, I don't believe we're doing a good job understanding the risks surrounding our kids. And I'm not talking about, and actually here's the interesting part, my wife and I sometimes discussing, okay, hey, we have little kids running around. We need to foolproof this area. We need to cover that area. We need to, foam blast that area. And sometimes I wonder, like, okay, they're kids, we were kids, we didn't have all these, I would say, protective barriers around, and we survived. But in reality, that behavior is wrong of mine because I will apply this across the board on every type of risk. So we need to do a better job as parents on being risk managers, because for our kids and for us, because what everything that we can struggle with is going to be visible to our kids, and then it might not be cause them maybe a direct effect, but trauma is going to be there for them, right? So we're responsible for that. So better job as risk managers, I would say, is what I want to take away from that as an individual and as a parent. And I believe that strongly that we have done such an amazing work at Dawn Health, and you guys know that more than I do, that we are focusing on the wellness and proactive approach on mental health because we don't see it as a disease. We see it as an opportunity to become more resilient as kids and as parents. And there is nothing better and nothing stronger than a very strong bond between the parent and the child. And that's helpful. I mean, all my friends I talk to is they are feeling fulfilled because they're happy with their family, with their kids, right? And I'm not saying happy because they perform academically or they're listening every time they yell at them. It's because they see that relationship flourishing, and there's nothing better than that.
Yeah, great points, Panos. I appreciate that.
Yeah, I know we're all very excited about where we're headed with Dawn Health and the system that we've all built and put a lot of work into. So if you're ready to take that next step, you can go to either app.dawnhealth.care or just dawnhealth.care and start your journey and join us on this and just be well together. Thank you, gentlemen, for joining us today, and everybody on LinkedIn, Facebook, Instagram, YouTube Live for hopping in. We will see you next month.
Take care.
Thank you.